Dear friends, most people believe breast cancer always shows up as a lump. And yes, lumps are one of the most common signs of breast cancer. But here's the truth. Some types of breast cancer develop in ways that affect the skin, lymph system or internal tissue without forming a distinct mass you can feel. These are as follows. 1. Ductal carcinoma in situ DCIS. It is an early stage of breast cancer that starts in the milk ducts. It usually doesn't form a lump. Instead, it is often seen on a mammogram as tiny white spots called calcifications. 2. Inflammatory breast cancer IBC. It is a fast growing type of breast cancer. It usually doesn't form a lump. Instead, it can cause changes in the skin like redness, warmth, swelling, or skin looking thick and dimpled. 3. Paget's disease of the breast. It is a rare kind of breast cancer. It mainly affects the nipple and the dark skin around it, areola. Instead of a lump, it may look like a skin problem with signs like dry or flaky skin, redness, itching, and crusting. It can be mistaken for a simple skin issue at first. Number 4. Lobular Carcinoma. It is a type of breast cancer. It spreads in thin lines through the breast tissue instead of forming a solid lump. Because of this, it may not feel like a clear lump and can be harder to notice during a physical check. Now we will discuss the signs of breast cancers without lumps. So, if there's no lump, what should you look for? Here are some warning signs people often ignore. These are as follows. 1. Skin changes. If you notice redness, swelling or a rash on the breast that doesn't go away, don't ignore it. Some people describe the skin looking like an orange peel. This is called pudu honch. The skin may also feel thicker or warmer than usual. These symptoms can sometimes be mistaken for an infection, but if they persist, get them checked. 2. Nipple changes. Next, pay attention to your nipples. Breast cancer can sometimes show up as nipple changes like turning inward, called inversion, unusual discharge or dry, irritated skin, even without a lump. These changes might seem minor, but they can signal underlying issues. 3. Breast shape or size changes. Another overlooked sign is a change in the size or shape of one breast. If one breast suddenly looks different, maybe swollen, uneven or distorted, it's worth paying attention. This isn't about natural asymmetry, it's about noticeable sudden change. 4. Persistent pain. Breast pain is common and usually not cancer, but persistent unexplained pain in one area shouldn't be ignored, especially if it doesn't seem linked to your menstrual cycle or goes on for weeks. 5. Swelling in lymph nodes. Sometimes the first sign shows up outside the breast. Swelling or lumps in the underarm or around the collarbone could indicate that lymph nodes are involved even if the breast itself feels normal. When to see a doctor. If you notice any of these symptoms lasting more than a couple of weeks, don't wait. Early detection can make a huge difference. Even if it turns out to be nothing serious, peace of mind is worth it. Why screening matters. This is exactly why regular screenings matter. Mammograms can catch cancers before you can feel anything, and it makes a huge difference in treatment and outcomes. If this video helped you, share it with someone who needs to hear this. And don't forget to subscribe for more simple, real talk health info.